I'd like to call our hearing entitled Abandoning Americans to Disease. The Trump administration's reckless crusade is harming America's health. That is the title of our hearing today. It, of course, is also in conjunction with our partners here in the Senate, which is, of course, where we are. And I want to begin, of course, by thanking Senator Blumenthal. The senator is right now on the floor. There is a vote that is occurring, and so you will be seeing members from both the Senate side and the House side coming in and out of our hearing as folks are arriving and taking votes. And so we do want to thank him and his incredible team, and especially for our witnesses for being here today. So thank you all for being here. I just want to begin. This is a very important hearing that we're having today on something that every single American is concerned about, and that is the health of themselves and the health of their own family. We're also here to highlight a new report that we just actually put out today. Now, our committee, Oversight Democrats, have reviewed thousands of pieces of evidence and spoke to more than 80 officials, experts, researchers from government, public sector, private sector, all to investigate the real costs of the Trump and Secretary Kennedy's agenda for our health, which has been a disaster. Now, Secretary Kennedy and Donald Trump have betrayed the American public. And I wanted to share with you some of what we have found. In this report, we have found a lot that should concern every single person, but I want to specifically broadly talk about three. First, we find that Secretary Kennedy and the Trump administration have been dismantling America's health research engine. America has always led when it comes to health research, but they have cut $16 billion in funding for cancer, Alzheimer's, diabetes research, driving top scientists abroad, and letting vaccine misinformation kill promising new treatments before they even reach patients. Second, Secretary Kennedy and the Trump administration are making Americans sicker while stripping away their actual protections. They've rolled back food and water safety. They've sold out to corporate polluters. They've gutted public health programs. They've eliminated healthcare access, all while pursuing policies that actually increase the very diseases that they're claiming to fight. And we find in this report that Secretary Kennedy and the president and the administration have essentially declared war on vaccines. They've politicized expert advisory committees. They've restricted access to COVID and childhood vaccines. They've censored safety data that put millions at risk of preventable illness, hospitalization, and death. This is a health emergency that is happening in this country, and every single American should be concerned. Now, we may never even know the full destruction that's happening right now at the CDC, at HHS, the way research has been weaponized. But one researcher actually told us directly that we're losing a whole generation of scientists. Now, some people will die waiting for treatments for diabetes, HIV, or cancer that this administration has either canceled or delayed. Now, other research is actually moving overseas to allies, to competitive nations, places that are undermining our health leadership. And the betrayal is just as bad in an area where RFK Jr. and Trump actually promised a lot of things to the public. Affordability, food for everyone. There were so many folks that supported President Trump and Secretary Kennedy based on this idea of healthier foods. But instead, what do we have? We have unaffordable food, sky-high prices, especially for basics like beef and other clear proteins. Fruits and vegetables, the costs have gone up. Now, last year, American families paid an extra $310 for groceries compared to before Donald Trump was the president. And prices have even surged more due to Trump's tariffs and wars. At the same time, Secretary Kennedy has worked hand in hand with corporate polluters. This isn't making Americans healthier. The administration slashed food safety workers and took food assistance away from more than 700,000 children across this country. Now, they're making it easier to spray or dump for chemicals that lasts a lifetime in our food and water. They're letting chemical companies and coal plants release more cancer-causing emissions into our air. This is wrong, and every American should be outraged. And the fact is the opposite of what Secretary Kennedy said he would do. I want to also discuss RFK Jr., Secretary Kennedy, and what he's doing with vaccines. He is fighting his own personal war and working quietly towards his anti-vax goals every single day. Now, for me, this is also very personal. Now, before I got to Congress a couple years ago, I was the mayor of my community, Long Beach, California. We, of course, across this country, lost 1.2 million Americans to COVID. In my community, we lost over 1,300 citizens of my city. Now, while we worked to expand hospital beds, provide masks, provide tests, we also learned a lot of hard lessons. My mom was a frontline healthcare worker, assisting nurses and doctors, and a proud union member. Now, the summer of 2020, my mom got COVID, and she passed away due to the pandemic. 2 weeks after my mom passed away, my stepfather died of COVID due to the pandemic. I lost 2 parents, both of which would have loved the opportunity to take the vaccine. Of course, they weren't available at that time. My mom was a healthcare hero, and when I think about what's happening right now to vaccination systems, it's both infuriating and at the same time, I am worried about the impacts to American families in the future. No one should have to experience what I and so many other families experienced during the pandemic by losing not just one parent, but 2 parents. There will be future pandemics, and I'm afraid that Secretary Kennedy and Donald Trump's policies are making it worse and making us less prepared. We, of course, are going to have Senator Blumenthal join us in just a few minutes. But before we do that, I want to begin and really welcome our incredible panel of witnesses. So I want to introduce our witnesses first, and then we do have a message also, which I think is going to be really great for the community. But I want to introduce our witnesses. I want to start with Dr. Daniel Jernigan, who spent more than 3 decades at the CDC, leading responses to outbreaks, including Ebola, H1N1, and COVID-19. He resigned in August 2025, saying he could no longer work within a system that has abandoned evidence-based science. He will speak to infectious disease response and federal public health workforce issues and scientific integrity at HHS. Thank you, Doctor. Also, Dr. Anita Patel, who's a pediatric critical care physician, an associate professor of pediatrics, NIH-funded researcher, and a mom based here in Washington, D.C. She will speak to how changing and confusing vaccine and health policies are affecting children and families actually on the ground. We also have Jonathan Agan, who became a childhood cancer advocate after losing his daughter, Alexis, to a rare pediatric brain cancer in 2011. He is the co-founder and executive director of Prep for Gold and has served on numerous federal cancer research panels. He will speak to what cutting scientific research funding actually means for American families and for patients. And we also have Scott Faber. Scott is a senior vice president at the Environmental Working Group and an adjunct professor of law at Georgetown University. Scott has spent years working on food, chemical, and environmental safety policy. He will speak to weakening environmental protections and the hypocrisy at the heart of the movement that Secretary Kennedy so-called leads. We're very grateful to all of these witness testimonies. And before we get to that testimony, we have a video from a person who couldn't be with us today, but is a longtime advocate on environmental issues and who has used his platform to bring attention to some of the topics we will touch today. I also, before I introduce Mr. Ruffalo by video, I do just want to also add that I'm grateful this hearing is also being streamed by numerous media partners, including, of course, the Senate and the House as well. And I also want to thank Senator Blumenthal, who is coming from the floor. So we're going to watch the video, and then I'm going to turn it over to the senators. So if we can just please watch the video. Thank you.
Thank you. Thank you for holding today's hearing. I'm sorry I can't be with you. I'm starting a new job. But let me just be clear. Weakening and delaying drinking water standards for PFAS is not making America healthy again. All of us have PFAS in our blood, and nearly half of us have PFAS in our drinking water, okay? Setting any drinking water standards for 6 PFAS was one of the greatest and biggest public health achievements in decades. And weakening and delaying the PFAS drinking water standard is now one of the biggest betrayals from the EPA in decades. People worked really hard in states and front lines, coming across both sides of the aisle to keep their families healthy. We were making America healthy again. Now, everyone agrees that clean water should be a right, not a privilege, regardless of where you live. But in Donald Trump's America, in Lee Zeldin's America, only some of us will enjoy tap water that has been stripped of PFAS. If you live in Ohio or Texas or North Carolina, your water will be dirtier thanks to Donald Trump and Lee Zeldin's EPA. Everyone agrees. No matter what your political beliefs are, your economics, where you live, everyone agrees that PFAS polluters should stop dumping their PFAS waste into our drinking water supplies. This is simple. It makes sense. But in Donald Trump's America, there's no limits on how much PFAS can be discharged into our rivers and lakes. And it's not just PFAS in our water. For most of us, our biggest source of PFAS is in food. But Donald Trump's FDA, with Robert Kennedy Jr. and all of his wisdom, has so far refused to set limits on how much PFAS can be in our food. He talks about what he's going to do, but he doesn't do it. I've had phone calls with him. He doesn't do it. Instead, Donald Trump has reversed our efforts to reduce PFAS in sludge used on farm fields and even approved new pesticides made with PFAS being sprayed directly on our food. Instead of fighting for us, Donald Trump's administration is run by polluters who want to cover for other polluters. And now, some Republicans, on behalf of the polluters, want to block states from protecting us too. So not only has the federal government left these regulations and taken them away, now they want to stop states from doing it. They want to preempt states from banning PFAS in food packaging. They want to preempt states from banning PFAS in cookware. America is sicker, not healthier, because Donald Trump's EPA and FDA are allowing more PFAS in our water and our food every single day, with every turn, every decision they made. Why? Why? Because they're bought by polluters. And we can't let the Republicans in Congress block the states from protecting us too. Right now, our states are the only protection we have from toxic PFAS. That's it. The EPA has abandoned us. They've rolled back what we fought for. The FDA is doing nothing. We deserve better. We deserve clean water. We deserve food free from toxic chemicals. Adding more toxic chemicals to our food and water will make us sicker, not healthier. It's all a lie. When they're telling us they're making America healthy again, it's a lie. So thank you for holding this hearing today. It's so appreciated. And I know all these frontline communities have been fighting this for years. We've lost family members to this. Are so upset and sad to see these standards be taken away in a whim. So thank you. On behalf of them, thank you. God bless you all.
Thank you, and I'm grateful to Mr. Ruffalo for that message. And really has been a healthcare leader across this country. I do now want to turn it over to Senator Blumenthal, who just came off the floor of the Senate with casting a vote, and very grateful for all of his work. So, Senator.
Thanks. Thank you so much, Representative Garcia. I'm very grateful to you and your staff as well as my own, for bringing us together today on this critical topic where public awareness and education are absolutely vital, and where our witnesses have contributed so much. I want to thank you for being here today, but more important, thank you for the great work that you have done throughout your careers, literally, putting your lives and your professional reputations on the line in favor of real public health. The Trump administration is committing a historic assault on public health, more severe than we've seen at any point in our lifetime. They've launched a series of baseless smears on vaccines that have resulted in many of those long suppressed illnesses roaring back. They've gutted basic research into cancer and other devastating illnesses. They have promised to, quote, make America healthy again, but freed polluters to dump forever chemicals into our nation's drinking water. And they are essentially threatening progress that has taken decades to achieve and doing damage that will take decades to undo. If nothing else, they are on the verge of destroying a lot of young careers, researchers who are going into other lines of work, abandoning promising potential cures for diseases, cures that can save lives. There are real-life outcomes to these cuts in NIH-supported research. They have shuttered offices on violence prevention and workplace injuries. They have stopped grants that prevent drug overdoses and respond to mental health crises. They've shackled careers of public servants who help review the safety of drugs and medical devices. These workers and programs have saved and bettered countless American lives. Their undeniable success has long earned them bipartisan support. We have always seen bipartisan support for the NIH, for cancer research, for even gun violence prevention and workplace safety. And now they are driving wedges where before we had consensus. The results are undeniable. The administration's senseless and frequently illegal decisions are leaving us more and more vulnerable to a public health crisis that could explode in any moment. In fact, we're seeing it exploding right now in Africa with Ebola, where our cuts have consequences that are visible in graves, literally in deaths that could be prevented. In just 18 months in office, Trump has hampered our ability to respond to this kind of growing crisis. In fact, on the first day of his second term, he announced the United States withdrawal from the World Health Organization. There was never anything partisan or political about the World Health Organization in its work. This kind of rash choice hinders our ability to lead the world, and the world needs leadership in public health. Weeks later, he eliminated USAID, an agency created by Congress whose emergency pandemic threats program was central to our ability to respond quickly to past outbreaks, including Ebola. There's a lot more I could say, but we really want to hear from our witnesses. So let me just say again, I'm grateful to you for being here today. I'm hoping that this message will break through the clutter of different media and messages that are out there literally every day of the week, every hour of the day, because what should really matter in making America healthy again is support for these public health initiatives that have taken so much hard work to build and now are in such grave danger of destruction. Thank you, Mr. Chairman.
Thank you, Senator. We're going to be getting to our witness testimony now. And I want to, of course, again, thank them for being here. We know that everyone has valuable information to share. Just please try to keep it to the 5 minutes as instructed. And then we'll have ample time for folks to ask questions. And so I want to begin, please, to hear from our witnesses. And we'll start with Dr. Daniel Jernigan.
Well, thank you very much. Thank you, Ranking Member Garcia, Ranking Member Blumenthal, and other distinguished members of Congress for the opportunity to testify. I'm Daniel Jernigan, and after a 30-year career at CDC, I resigned as director of the National Center for Emerging and Zoonotic Infectious Diseases because I could no longer stand behind actions that undermined evidence-based decision-making, the practice of science, and CDC's core mission of protecting the American people. Let me say at the outset, the chaos and implications of the past year are extremely severe, and I can only offer a few examples today. If you take one thing away, let it be this, that there has been effects on the nation's health. CDC functions as the nation's doctor, and while a clinician treats an individual patient, CDC identifies threats, evaluates evidence, and develops interventions that prevent illness and deaths across entire communities. Over the past year, actions taken by the current administration have dismantled effective programs, weakened frontline defenses, and created dangerous gaps in America's health security. Although the administration claims it is making America healthy again, its actions on funding, staffing, and science have had the opposite effect. First, public health funding has been destabilized. Congress appropriated these dollars because they prevent deaths, illness, injury, chronic disease, and outbreaks. Yet the Office of Management and Budget has clawed back funds intended to strengthen state and local health departments, slow-walked distribution of appropriated dollars, and inserted sweeping for any reason determination clauses into routine grants. Hundreds of millions of dollars are currently being withheld, and more than 80% of CDC's budget currently flows directly to states, tribes, territories, and local communities. When funding is delayed or threatened with sudden termination, communities can't plan, they can't retain staff, and they can't sustain life-saving programs. The consequences are real. For instance, youth violence prevention funds were held so long that community organizations nationwide laid off trusted intervention workers and halted active programs. Second, the administration has executed sweeping reductions in force. They've had contract terminations and pressured retirements that have purged over a quarter of CDC's workforce. This is not right-sizing. It's the loss of epidemiologists, laboratorians, data scientists, health communicators, and program experts whose skills cannot be quickly replaced. Entire divisions have been left unstaffed. The pipeline of future public health leaders has been severed. The April 2025 cuts eliminated nearly everyone responsible for CDC's smoking cessation programs and the entire workforce dedicated to preventing concussions, drowning, and falls among older adults. The end of CDC's Heads Up campaign means there is no longer a federal capacity to update pediatric concussion guidance relied upon by millions of coaches, schools, and clinicians. Finally, scientific integrity has been eroded. True gold standard science requires transparency, expertise, and freedom from political interference. Instead, scientific advisory boards have been dissolved or stripped of experts. Evidence-based processes have been replaced by guidance issued through social media without scientific basis. And communication with state and local partners has been restricted, and updates on critical health threats have been delayed or withheld. The consequences are visible. By freezing the U.S. Preventive Services Task Force and leaving half its seats vacant, the administration has blocked updates to preventive health guidelines, including cervical cancer screening. Vaccine policy has descended into confusion, contributing to rising cases of measles and pertussis, and a federal judge has ruled that the administration's reconstitution of the Advisory Committee on Immunization Practices was likely illegal, leaving the country without updated guidance for this winter's flu and COVID-19 vaccines. America's public health system needs modernization, but ending effective systems and replacing them with untested alternatives is not efficiency, it is recklessness. Cutting staff without regard to operational consequences creates gaps in national health security. And replacing evidence-based processes with non-scientific directives weakens the systems that protect Americans. I urge this committee to demand accountability for actions that disregard congressional intent, that weaken the public health workforce, and erode the scientific standards that underpin sound health policy. CDC exists to protect all Americans, and weakening that mission leaves every community more vulnerable. Thank you.
Thank you. Dr. Patel.
My name is Dr. Anita Patel. I'm a pediatric critical care physician, associate professor of pediatrics, and an NIH-funded researcher with over a decade of experience caring for the sickest children in the Mid-Atlantic region. I'm also a mother of 2 young children. Those 2 identities, a mother and a physician, have never felt more intertwined than they do right now. I want to tell you about a child I cared for recently. He was born with a congenital heart defect. His parents were devoted, thoughtful, and terrified in all the ways all new parents are, amplified because of his heart defect. They were not anti-vaccine, but they were hesitant. At his 2-month visit, he received his first round of vaccines right on schedule. But then the language of shared clinical decision-making reached them. That phrase, which in medicine has legitimate meaning, has been weaponized into something else entirely. It became a permission structure for doubt. He did not get his 4- or 6-month vaccines on time. And then he got sick with the flu at 9 months, a respiratory illness that most healthy children might weather at home became for him a catastrophe. Children with congenital heart disease hospitalized for the flu have mortality rates 4 times higher than other children and are almost twice as likely to need a ventilator to breathe in an ICU like mine. He survived, but his road was longer and harder than it ever needed to be. That family did not fail their child. They were failed by a public health system that was deliberately seeding doubt and confusion and no longer speaking with one clear voice. That is what modern shared clinical decision-making pushed by our health leaders actually means in clinical practice. The slow erosion of confidence in vaccines caused an exhausted family with a medically fragile child to wait and see. And for a child with congenital heart disease, waiting can cost everything. But this is not just one family. In 2025, the United States had its worst measles outbreak in over 3 decades. The U.S. has already reported more than 2,160 measles cases to date in 2026. Measles vaccination coverage rates among kindergartners have dropped below the 95% threshold for herd immunity, leaving nearly 300,000 children in our country unprotected. This is not a coincidence, it's a consequence. And the policy changes compounding this are alarming. The federal childhood immunization schedule was recently overhauled, reducing universally recommended vaccines from protecting against 17 diseases to only 11, with no new evidence to support the changes. Among the casualties, the hepatitis B vaccine at birth, which had driven a 99% reduction in childhood Hep B infections, is no longer recommended. Now, I want to address the movement behind these changes directly and carefully. The concern that American children are facing a chronic disease crisis is real. Physicians have been raising that alarm for years, and I share that concern. But there is a profound contradiction at the heart of how that concern has been translated into policy. And I want to be clear, this is not a partisan observation, it is a clinical one. You cannot claim to protect children's health while dismantling the immunization infrastructure that keeps them alive. And also, while seeding the information environment with doubt and cutting Medicaid that programs covers nearly half of Americans' children. I love being a pediatrician and dedicating my clinical and research work to improving children's health. I feel the weight and the privilege of partnering with families to protect their children. But it is harder to do this work when the ground underneath public health is shifting. When families are hospitalized after being told to distrust the evidence-based medicine I practice. My patients cannot speak for themselves at the bedside. They are counting on us to speak for them. Vaccines work, the evidence is not ambiguous, the stakes are not abstract, and the children in our intensive care units deserve a public health system that is worthy of their trust.
Thank you very much for that. Mr. Aiken, please, for your remarks.
Thank you, Senator Blumenthal, Representative Garcia, and other esteemed members, as well as my fellow witnesses. I want to thank you for convening this hearing today and inviting me to discuss a topic that is of fundamental importance, specifically the current climate of regressive policies as they relate to medical research funding, program support, and the overall tenor of hostility towards the research and medical community and the relation to childhood cancer. On April 11th, 2008, I heard the words, "Your child has cancer." The oncologist that broke this news then shared that my then 27-month-old daughter was diagnosed with terminal cancer. Alexis was diagnosed with the deadliest childhood brain tumor known as DIPG, diffuse intrinsic pontine glioma. The only standard of care at the time, and to this day in fact, was radiation. Alexis received the same therapy that Neil Armstrong's daughter Muffy, who was diagnosed with the same type of cancer in 1963, received. Alexis survived for 33 months and participated on 5 different clinical trials. She took her last breath before my eyes on January 14th, 2011 at 3:03 p.m. As a result of Alexis's diagnosis and death, I made the decision to leave the practice of law. In the 18 years since her diagnosis, as was mentioned, I've co-founded the Prep for Gold Childhood Cancer Organization, which focuses on prevention. I've been a part of the NIH Steering Committee with the NCI and the Brain Malignancy Steering Committee. I've been a grant panel reviewer for the DoD Congressionally Directed Medical Research Program. I've co-founded a nonprofit childhood cancer research biotech known as the Children's Cancer Therapy Development Institute, and I founded the Childhood Cancer Prevention Symposium and Childhood Cancer Prevention Consortium. Most recently, I was appointed to the Data Safety Monitoring Board of the Pediatric Brain Tumor Consortium, where we meticulously look at the results of the children on clinical trials to assess risks to participation. Childhood cancer research and the funding that fuels this work represent hope. Unfortunately, the reality of childhood cancer is far different from that portrayed in commercials. Childhood cancer remains the #1 cause of death by disease for children in the United States. Every day, 2 full classrooms of children are diagnosed with cancer. Since 1975, the incidence rate of childhood cancer in this country has risen by over 41%. This is not genetic, as only 10% or less of all childhood cancers have a genetically inherited component. Ironically, most children that survive 5 years from diagnosis are left with lifelong acute health issues because of decades-old therapies. What we are witnessing today in this country because of the administration's policies and contempt for science is nothing short of tragic. Cuts to research funding, cuts to specialized research consortia such as the PBTC, and changes to how the research grants are administered and funded have created a climate of fear that is dissolving hope. This administration and people like HHS Secretary Kennedy are politicizing the current and future health of the most vulnerable of our society. In August 2025, HHS and National Cancer Institute leadership inexplicably made the decision to end funding for the PBTC. The PBTC was a specialized, disease-specific consortium of highly regarded institutions and children's hospitals dedicated to understanding the challenges behind childhood brain cancer through multidisciplinary clinical trials. Of the 12 major categories of childhood cancer, brain cancer is the leading cause of death. The explanations for this senseless decision have been thoroughly unsatisfactory. Parents who had a child on a trial were immediately sent into panic, fearing that they would lose access to study drugs. Thankfully, this did not occur. Unfortunately, with the end of the trial, participation on any of these clinical trials was not tracked as was during the initiation of the trial, and thus more data was lost. Uncertainty as to the location and access to study data was of immediate concern to consortium members and institutions. A new framework through PEP-CTN has been announced, but the reality is that to fully operationalize a specialized network like the PBTC, it will likely cost more than it would have to continue the PBTC. Additionally, threats to research budgets at HHS and NIH have created a climate of anxiety and fear. In May 2025, it reported that the administration proposed cutting NIH's budget by 43%. The fiscal year 2027 budget proposes an overall reduction of $15.8 billion for HHS, which obviously oversees the NIH. These are staggering numbers. If cuts of this magnitude were to indeed come to fruition, the result would present a risk to the security of the United States by allowing countries like China to decimate this country's scientific output and standing on the world stage. Further, the administration, with the support of people like Secretary Kennedy, are creating a politically charged atmosphere for science that is culminating in the termination of promising therapeutic technologies. In August 2025, public investment into mRNA vaccine research totaling approximately $500 million was canceled. The tragedy is that research on the use of mRNA technology for the development of cancer vaccines, which in fact is decades old, represents one of the most promising avenues for developing personalized therapies for treatment and prevention. Sadly, there were plans to open a trial using an mRNA vaccine to treat the very cancer my daughter died of, and the preliminary results provided hope. Despite this administration's outward support for disease prevention, especially as it relates to the MAHA movement, its actions demonstrate contrary intentions and hostility towards the advancement of medical science. As noted in my written submission, I do acknowledge the administration's commitment to the direction of funding for the use of AI and data to help in the fight against childhood cancer. The administration's stated commitment to double the amount of funds to the Childhood Cancer Data Initiative, or CCDI, is a positive step. Unfortunately, when taken as a whole, this administration's record is ultimately placing children with cancer in harm's way. The real cost of this climate of uncertainty is felt by parents of children with cancer, patients, scientists, advocates, and clinicians who have dedicated their lives to the fight against childhood cancer. The impact will leave a hole that will need to be filled that will take decades. In closing, it's shocking that in 2026 we find ourselves facing these issues and witnessing as science is being defunded at the cost of patients' lives. I urge members of the House and Senate panels here today to please fight to maintain the scientific standing of this country. Thank you.
Thank you so much, Mr. Aiken. And Mr. Faber, thank you, your testimony.
Great. Thank you for the opportunity to testify. My name again is Scott Faber, and I'm the Senior Vice President for Government Affairs for the Environmental Working Group. I also teach food law at Georgetown University Law Center. Let me start by saying MAHA leaders are right when they say that our food should nourish us, not make us sick. Too much of our food is contaminated with pathogens, with heavy metals, with toxic chemicals, contaminants like PFAS, and engineered with the tobacco industry's know-how to interfere with our brain's reward centers in ways that tell us to keep eating. No wonder diet-related disease is now the leading cause of death in the United States. No wonder so many Americans were excited when Secretary Kennedy and other MAHA leaders pledged to get toxic chemicals out of our food, pledged to put the people we trust, not the food industry scientists, in charge of deciding which chemicals were safe to eat, and promised to tell us which foods were ultra-processed foods that we should avoid. This is not a partisan issue. All of us agree that our food should be safe, healthy, and affordable, so it should be no surprise that MAHA promises to ban toxic chemicals, to close the loopholes that let the food chemical companies decide which chemicals are safe to eat, to get PFAS out of our food and water, to require front-of-package warnings on ultra-processed foods are popular ideas. Indeed, many of these ideas are not new. In fact, Senator Blumenthal, you've proposed many of these ideas in the past. However, these promises to get the toxic chemicals out of our food, to help us build healthy diets, are unfulfilled. So far, the administration has not banned a single toxic food chemical and has not narrowed the loophole that's letting the food chemical companies decide which chemicals are safe to eat. Instead, the administration has so far made our food less safe by firing food safety experts, by reducing the number of food safety inspections, by reducing the number of pathogens we must track, by withdrawing standards for pathogens like salmonella, by delaying efforts to trace the sources of foodborne illness. While MAHA leaders have sounded the alarm about the risks posed by pesticides, the administration has so far granted or sought to grant legal immunity to pesticide companies and approved other new dangerous pesticides, as Mr. Ruffalo mentioned, including pesticides made with toxic forever chemicals, or PFAS. What's more, the administration has so far refused to set limits on the amount of PFAS that can be in our food and has instead weakened the standards for PFAS in our tap water. And while it's good news that the administration has updated our dietary guidelines to urge us to eat real food and to avoid highly processed foods, the administration has so far cut funding for the programs that provide us fresh, local food, especially for our schools. The administration has not yet defined ultra-processed foods as promised and has not yet proposed a front-of-pack disclosure to help us identify and avoid ultra-processed foods in the grocery store as promised. So far, the administration has made these real foods they've encouraged us to eat more costly. As Mr. Garcia, as you mentioned, our food prices have gone up since January 2025 by 3%, especially for the healthy foods that the administration wants us to eat. Vegetable prices, in particular, have increased by more than 11% since 2026. So let me close by saying we all agree that our food should be safe. Our food should not be filled with toxic chemicals. Our food should not be filled with pathogens. Our baby food in particular should not be filled with toxic metals. Everyone agrees that we should be reducing the amount of PFAS in our food and water, not increasing the amount of PFAS in our water. So far, the administration has not fulfilled the promises that they've made to the American people to reduce the presence of these toxins in our food and to help us build healthier diets. Thank you.
Thank you. And with that, we have some questioning that we're going to go ahead and begin. I will begin that questioning, and then I'll turn it over to Senator Blumenthal. But I do want to thank all of our witnesses again for being here and for your courage, and really for this important discussion, to hearing from you, but also to answer the questions. So thank you again. So I want to just begin with some questioning. And I just want to start by recognizing again that we have to be very clear-eyed about what's happening right now across our agencies, not just at HHS, but the impact, of course, that Secretary Kennedy is having to the affordability for families, to the attacks on the CDC, what's happening across academic institutions across this country because of these actions, what's happening to research, what's happening to the global health community. All of that goes back to these horrific decisions happening every day within our government. Now, Dr. Jernigan, you are one of the nation's top medical experts with decades of experience fighting infectious disease outbreaks from Ebola to COVID. You've testified and spoken about your decision to resign in protest from the CDC. We've heard that. COVID is a topic, as we know, that has been incredibly important for us to discuss and not politicize. But the consequences of pandemics in the future are real, and it's important that those are discussed, not just as it relates to COVID, but also, of course, Ebola, the measles, and so many other issues that we face as a country. Now, we're seeing right now an Ebola outbreak that has been facilitated by cuts to the federal workforce and Secretary Kennedy's, in my opinion, incompetence. Can you tell us again how our ability to protect Americans against future pandemics has been weakened by this administration?
Yeah, thank you very much. And so you mentioned the issues in Ebola in Africa, over 1,000 cases now. First identified Ebola in 1976, 50 years ago, and now we find that this is the third largest of the Ebola outbreaks, even though we've only known about it for just a few months. If we think about readiness in the United States, there have been three things that have happened that the Secretary has really been involved in, along with the Department of Government Efficiency and with OMB, in terms of decreasing staffing, decreasing funding, and leading to some problems and concerns about the credibility of our science. If you think about state health departments, they are the ones that have to respond to a big emergency that may occur. We have delayed funding to them so that they've had to let people go. We have provided less scientific expertise to them, and we have taken back funding to make the laboratories better. There was funding that was set aside to go toward genomic sequencing, things that are much better innovations, and what we find is that is pulled back, so the states and the federal government are less ready right now for a pandemic than we were before the last pandemic. And that's because of those cuts to staffing, the cuts to the funding, and also because of the credibility in leadership, the scientific leadership that's really been undermined.
Thank you for that. I do have a couple, these are some kind of quick, kind of yes or no questions to really, I think, make the point to the American public and the community about what is actually happening with our health program. So I'm going to have Dr. Patel, Mr. Aiken, as well as Mr. Faber, just some quick questions. So just put those into the record, and I'll start with Dr. Patel, and I'll just go down the line. Dr. Patel, has the Trump administration made it more difficult for parents trying to keep their children healthy?
Yes.
And are fewer people across this country getting vaccinated?
We have had to make a notification because there are so many unvaccinated children.
And are we seeing fewer children get vaccinated?
Absolutely.
Now, Mr. Aiken, has the Trump administration, have their policies actually impeded life-saving discoveries in childhood cancer research?
Yes.
Have they disrupted research and clinical trials for new cures?
Oh, absolutely.
Do you believe people will die waiting for new cures and new treatments because of the actions of this administration?
Certainly, progress has been delayed.
And Mr. Faber, has the Trump administration jeopardized access to a healthy and affordable food for families?
Yes.
Do you believe Secretary Kennedy and HHS has broken their promise to make our children healthy again?
Yes.
Have they cut nutrition assistance for 800,000 kids across this country?
Yes.
Now, does it harm children's health to take away affordable food?
Of course. Yes.
And finally, is the Trump administration actually increasing people's exposure to toxins and pollutants?
Yes.
Now, thank you. I think it's important that we set the record really straight about what's actually happening across this country as it relates to food safety, keeping kids healthy, and our communities healthy. Secretary Kennedy is supporting more pollutants in our system, supporting more destruction of our ag system as it relates to more pollution in our crops and in our food. The president is making food more expensive, including foods that are considered healthy foods. We are eliminating research from our institutions. We're cutting grants and research across our universities. And as you've all noted, we have less support for important research for our children as it relates to cancer and the exposure to future pandemics. There is nothing about this administration that is making America healthier. This country is getting every single day a little bit sicker because of their actions, and every American should be concerned. And with that, I want to yield back and turn this over to Senator Blumenthal.
Thank you so much. Thank you, Mr. Chairman. You know, the administration talks about gold standard science. Everything about this administration seems to be gold. Ballrooms, arches. In science, gold is not the metric. It's human lives and human sickness. So I'd like to ask anyone who would like to comment maybe some specifics about diseases that we are failing to confront, illnesses that are going untreated because science has been stopped, our investment has been paralyzed, and out in the field, public health efforts that have been stymied. I'll just open it to all of you for some specifics.
I think the simplest answer to your question is related to the flu vaccine, which is no longer recommended. It's available. But I think the flu vaccine is a microcosm of what we are seeing, in that HHS state that they are not taking anything away. But the mere fact of removing universal recommendations not only gives parents permission to wait, but it sows doubt in their minds about all vaccines. And I live in a blue dot in our nation. If I am seeing under-vaccination, unvaccinated children, I can't imagine, or I can based on the data, what is happening for the rest of our country. And this is life or death.
Senator, certainly in answer to your question, two of the examples that I gave in my testimony, the cancellation of the Pediatric Brain Tumor Consortium and the cancellation of $500 million worth of research funding for mRNA research into the use of that technology in vaccines, is having a detrimental impact. The PBTC was a tremendously specialized network. Now it's rolled into PEP-CTN through NCI. PEP-CTN is a general body for childhood cancer phase 1 trials. It's not specialized for brain cancer. And there are so many differences in treating the various forms of childhood cancer that the cancellation of such a specialized network that had been around for 25 years makes no sense whatsoever. So certainly, we're seeing children being
People are
put.
dying as a result. People are becoming ill as a result.
Yeah, certainly. I mean, there's the initiation of specific clinical trials for pediatric brain cancers that have almost 100% mortality rate, like DIPG or ATRT. I truly believe that we will see fewer clinical trials and more limited access to studies that are specifically designed for those children.
Yeah, I think just to follow on, as the former director of the influenza division, influenza in military has been with us for a very long time. And when military troops are not getting vaccinated because it's an option, you end up with these big outbreaks like we just had recently that was reported. In addition, we're seeing increases in measles. That we have almost as many cases now this year than we had all of last year, and also increases in pertussis and pertussis deaths. But one really important factor, I think, is that the removal of the USAID and removal of PEPFAR and the President's Malaria Initiative, we are seeing increases in HIV deaths, and increases in malaria deaths. And so these are very real things that are happening because of the decisions that were made.
I'll just quickly add that more than half of our calories and more than 60% of our children's calories now come from ultra-processed foods, foods that have been engineered in ways that make food literally irresistible. The administration has said, has pledged, has promised that they will define ultra-processed foods, and Secretary Kennedy says he will put a warning, a disclosure on our foods to help us avoid ultra-processed foods in the grocery store. But so far, it's just been states like California that have defined ultra-processed foods and decided to phase them out of our schools. And tonight I'll fly to Sacramento to testify tomorrow in support of a bill to help put a non-UPF seal on foods. It's one example of how, as Mr. Ruffalo said, states are really the only consumer protection tools we have, and that's why it's so important to preserve those consumer protection powers. They're under attack right now, as you know.
I want to, again, thank you all. You know, it strikes me talking about processed foods, which in my non-scientific view are becoming more and more addictive because the combination of sugar and salt and the texture of foods and other factors involved in them become more attractive, so that whether it's a physical attraction or an emotional comfort that people get from them. But it seems to me that addiction in America today is growing in lots of different ways that we don't fully understand. Gambling addiction, not just substance use disorder addiction, certain food addictions, addictions potentially to the supplements that have been encouraged by this administration, notwithstanding the Make America Healthy Again. Supplements are totally unregulated as to efficacy and safety. Yeah. So we're taking steps back in ways that we don't fully comprehend today.
Well, as you know, Senator, from your role as Attorney General, the tobacco companies owned the food companies for about 40 years.
Yeah.
And during that period, we're now learning they used tobacco industry know-how, R&D, to literally engineer our foods to have addictive properties. We know this because of the tobacco settlement. There are now more than 20 million records that are available because of the settlement. And experts in California at UCSF are digging through those documents and finding the evidence that companies use this know-how to make our food more addictive, to have addictive properties.
And the marketing and promotions were very purposeful, aimed at children, which we uncovered in the course of our litigation,
Right.
that the tobacco companies not only knew about it, but actually exploited
That's right.
the promotions to children, not just teenagers, but literally 6-year-olds, 8-year-olds, to begin smoking. And the same now is true of gambling, the promotions to children, certain foods, and it's all to exploit the kinds of potential addictions that can result. Thanks, Mr. Chairman.
Thank you so much, Senator. Next up, I'd like to have Representative Krishnamurthy.
Thank you, Mr. Ranking Member. Thank you to the witnesses for coming here. Dr. Jernigan, you spent more than 3 decades at the CDC responding to infectious outbreaks across the country, right?
Yes.
You have to speak loudly into the-
Yes, I do.
Okay. Since taking office, the Trump administration has fired thousands of health officials at the CDC, has cut funding by tens of billions of dollars across our public health programs, and knowingly spread misinformation about vaccines. These actions have not made America healthier again, right?
Correct. Correct.
Look no further than the New World screwworm, one of the grossest animals I've shown a picture of. Last year, an article in Forbes actually reported that DOGE eliminated the project dedicated to monitoring and containing New World screwworm in Central America. guess what happened? Over 180,000 new cases of New World screwworm appeared in animals throughout Central and South America, along with 2,000 cases in human beings. Now it has arrived in the United States. And Dr. Jernigan, it says here, the CDC activated an emergency operations center for the New World screwworm, right?
Yes,
And that's a direct result of cutting funding for monitoring of New World screwworm, right?
I can't say exactly what the connection was there.
You're such a scientist.
I know. It's hard to not be government, by the way.
That's what we love about you. But that was the direct result here. Let me turn to whooping cough. Since taking office, Secretary Kennedy has repeatedly cast doubt on the safety and efficacy of all vaccines, including whooping cough, right?
Say that one more time.
Since taking office, Secretary Kennedy has repeatedly cast doubt on the safety and efficacy of vaccines, right?
Correct, multiple vaccines, including DTP.
And now declining vaccination rates have helped fuel the nation's largest whooping cough outbreak in over a decade. In fact, just last year, there were more than 28,000 confirmed cases of whooping cough, resulting in the deaths of 16 individuals. That's not making America healthier again, right?
Correct.
So whether it's screwworm, measles, whooping cough, or other public health crises, the lesson is the same. When we weaken our nation's public health systems, we are making Americans hurt again. That's the new MAHA, not making them healthier. Let me turn to my next topic. Mr. Faber, I want to turn to the hypocrisy of the MAHA movement. After reports revealed dangerous levels of toxic heavy metals in baby food, as you know, a congressional investigation I helped lead found that baby food manufacturers knowingly sold products with dangerous levels of arsenic, lead, cadmium, and mercury. These metals risk infant neurological development and long-term brain function, right?
That's correct.
In 2024, soon-to-be Secretary Kennedy posted on his Twitter, quote, toxic metals in your infant formula, anyone? When I'm in the White House, the FDA will be on top of this. You don't dispute he tweeted that, right?
That's right.
And despite Kennedy's promise, the FDA has failed to create any enforceable limits for heavy metals in baby food, right?
That's correct.
In fact, in 2026 alone, parents have filed more than 200 lawsuits against baby food manufacturers alleging a systemic poisoning of their food, right?
Correct.
This is exactly why I introduced on a bicameral basis the Baby Food Safety Act, which you have endorsed, which would establish enforceable limits for toxic heavy metals in baby food and strengthen the testing requirements for those metals. If Secretary Kennedy is serious about stopping the mass, what he calls the mass poisoning of American children, he will actually implement the regulations with regard to toxic heavy metals in food and endorse this particular piece of legislation. Mr. Faber, I want to turn your attention to youth vaping. Actually, Mr. Jernigan, I want to turn your attention to youth vaping. Since I helped lead the first investigation into Juul in 2019, I've worked to expose the vaping industry's efforts to hook children on nicotine, specifically through vapes. Dr. Jernigan, according to recent FDA stats, almost 1.5 million middle and high school children used e-cigarettes last year. You don't dispute those stats, right?
I do not.
NBC News reported that the Trump administration placed the entire CDC staff responsible for monitoring vapes and youth on administrative leave, correct?
That is correct.
The entire staff, right? Not a single person was left to man the shop, so to speak, right?
There may be one person left.
Maybe one.
Yes.
And despite the continued prevalence of youth vaping, the FDA has now begun authorizing flavored vapes for the first time, right?
Correct.
Flavored vapes hook young people, plain and simple, with most teens reporting that their first vaping was with a flavored product. And guess what? Just 1 week after the administration moved to deregulate flavored vaping products, public reports showed that the president's PAC received a $5 million donation from Reynolds Company, which profits from selling the very vapes that hook children. Isn't that right?
Correct. Yes.
Youth vaping remains a serious public health epidemic. But it's just one example of a broader pattern, which is that the administration puts profits of industry players over the health of this country. That is not making America healthy again. Thank you, and I yield back.
Thank you so much, Congressman. Next up is Representative Stansbury.
All right, well, good afternoon, everyone. I'm grateful to have the opportunity to talk about MAHA and what it actually means for the United States. I want to ask our panelists today about how we rebuild this system that has been so decimated, but I want to offer a few of my thoughts before I ask for your feedback on where we go next. You know, I think like many Americans, this was one area where I thought actually I might have some overlap with this administration, because I've worked my entire life in environmental policy, conservation policy. I grew up in a family where we ate whole foods. It was part of our lifestyle and way of life. And I think the vast majority of Americans, though we enjoy a little junk food here and there, agree that we should have access to food that's healthy for us, that we should not have chemicals in our water and in our food, and that every single American should have access to health care. And so I approached this administration's commitment to the Make America Healthy Again initiative with some hope, but some healthy skepticism. And I have to say that within the first several days of this administration taking office, it was clear that they were actually gutting the fundamental programs that actually would make America healthy, whether that is our CDC and the programs that help to prevent disease. It's the clinical trials that have been undertaken for decades that were saving lives, especially in specialty healthcare areas, whether it was the USDA programs that were preventing totally preventable diseases in our livestock, or whether it was the Environmental Protection Agency that literally was created to keep chemicals out of our food, air, and water. And it became clear that this administration had so little regard for actually walking the walk that within the first several weeks, they were gutting these agencies, firing ultimately tens of thousands of lifetime scientists, doctors, experts, people who had dedicated their careers to actually ensuring that the American people were safe and that the products we put in our bodies and in our environment were actually okay, and ultimately has continued for the last year and a half. And I think a lot of this ground has been covered, but I just want to point out the impacts in New Mexico, because this hits close to home for us. In fact, measles, which 26 years ago was essentially considered eliminated in the United States, since Donald Trump took office, has skyrocketed, and New Mexico is one of the places where we have been hardest hit. In addition to that, our state is now ground zero for the outbreak of the screwworm outbreak that has just re-entered the United States. And I hate to show a picture of an animal suffering, but I need to say that literally New World screwworm was eradicated in the United States since 1966. And this administration, because it gutted science, it gutted detection, it gutted the actual fundamental programs to prevent this, are completely responsible for what is happening right now. And this is not only devastating, obviously, to livestock, but to our entire potential economy in rural America. And so I could not possibly be more exercised about what has transpired over the last year and a half. And don't even get me started on chemicals, PFAS, the approval of tobacco products for children after they gave campaign donations to Donald Trump, medications that are unproven that have been approved by the FDA, chemicals that had been decades in the making of eradication. This Environmental Protection Agency even tried to intervene from an international pharmaceutical company having to pay out for glyphosate, killing people, giving them cancer in a court order. I mean, this is how far they've gone. And I think what we've seen in this administration is not a MAHA movement, but collusion, corporate giveaways, corruption, and ultimately cruelty, because it's been on the backs of the American people. And so the question I would like to ask all of you, because you have expertise across many different spheres, is how do we fix it? What comes next? How do we rebuild our public health?
Yeah, so I think the first thing is really, how do we allow the CDC to begin hiring again? So many people were lost, 25% of the overall amount. Just in the group that does Ebola and pox viruses and hantavirus, they've not been able to hire in those folks that are the laboratory specialists and epidemiologists. So allowing the agencies to begin to hire again and recognizing that there were mistakes that were made in those hiring practices or the firing practices, that would be a very important thing. The other is to have stability of funding and making sure that the state health departments are getting the funds to do the work that they need to do. Whenever there's delays or uncertainty, people lose their jobs. And so making sure that the money is there, the money gets out the door, it's not being held up by political processes. Those are the kinds of things with staffing and funding that we really need to make sure happen.
And Mr. Chairman, I know my time slot is over, but would it be okay for others to answer? Please.
I want to speak to this question from the perspective of a researcher. And I will be quick, but I've lived in this area my whole life, and I have been working at the NIH since I was 12. I'm a career scientist in every possible way you can say it. I am in a situation where I'll be unfunded for the first time as an attending in critical care in a month. I almost went into industry because I believe in the research I'm doing. I'm helping detect children before they deteriorate. It's running on every single patient in my hospital right now. It will save lives, but now we have no funding to do it. I can say immediate consequences of that, but I do want to represent researchers in the moral injury we are facing. We have accepted jobs paid less than our colleagues because we believe in open science. And now an entire generation of researchers is being told that open science doesn't matter. If you want to do research, go get paid by industry, and that's it. So we are going to have to recoup our researchers and provide them funding and stability.
Thank you. I'm going to go ahead and, if we can just keep the next answer is very, very brief, please. We need to move on to the next representative.
We need to prioritize childhood cancer as a research target, frankly. The funding for childhood cancer has been very paltry, and it needs to be increased dramatically. We also need to ensure that science is, again, prioritized and not demonized. That's a quick answer.
And we need to preserve state powers while we rebuild this infrastructure. It's New Mexico and 12 other states that ban PFAS from our food packaging and cookware. It's Virginia and 9 other states that ban synthetic dyes from our school foods. It's California and West Virginia and Arkansas that have banned the most toxic chemicals from all of our foods. And as some of you know, certainly Mr. Ruiz knows on Energy and Commerce, the food and chemical companies are fighting like heck to block our states from protecting us and repeal all the progress our states have made.
Thank you very much. Representative Randall.
Thank you, Mr. Ranking Member. The Trump administration, as we have established today and we all know, is making children and families more vulnerable to illness by halting research, dismantling public health agencies, undermining vaccine access, and breaking its so-called MAHA promises. And last year, the Republicans' big ugly bill began stripping health coverage from 15 million Americans. At the same time, Secretary Kennedy intensified his anti-science agenda by firing all 17 members of the Advisory Committee on Immunization Practices, or ACIP, and replacing them with hand-picked individuals who share his anti-vaccine views. These actions are not designed to make us healthier. They're designed to weaken vaccine recommendations, create confusion for parents, and restrict access to life-saving protections. Our nation was already facing serious healthcare challenges before the pandemic, and this administration continues to put lives at risk with almost every decision. In my home state of Washington, childhood vaccination rates declined during COVID-19 and have yet to recover, leaving more communities vulnerable to outbreaks of preventable illnesses like measles. Washington has also seen troubling declines in hepatitis B birth dose vaccinations, which are typically given within the first days of life. Coverage has fallen from 80.9% in 2019 to 69.5% in 2025. And last year, the Trump administration canceled $160 million in congressionally approved public health funding just for Washington state. Those dollars supported disease monitoring, reporting systems, and vaccine-related work on not just COVID-19, but many other viruses. And in my district, parents, grandparents, healthcare workers, and immunocompromised individuals tell me all the time that they're trying to do the right thing for their families. They're trying to make the right choices, but they're struggling to know who to trust amidst the chaos, the misinformation, the lies coming from this administration. The Lowry family from Port Orchard is just one of these examples. They lost their daughter Piper to the flu 10 years ago. Piper was a healthy 12-year-old with asthma who died from H1N1 and acute renal failure, but she was afraid of needles. I'm so grateful to the Lowry family for sharing their story about their own confusion, their own loss, and advocating for annual flu vaccinations so that no other family experiences a devastating loss like theirs. Dr. Jernigan, I'm so grateful for your decades of service to the CDC, including your leadership responding to many public health emergencies. You were vocal about your resignation as the former director of CDC's National Center for Emerging and Zoonotic Infectious Diseases. And in your words, politics needs to be out of public health. I wholeheartedly agree. What should Congress be watching as indicators that scientific expertise is either being appropriately incorporated into decision-making or being sidelined?
I think it's a great question. And historically, and I've been through many different administrations and have seen both Democrat and Republican, but making sure that science is at the center of what happens, so that the evaluation of the data, the interpretation, the recommendations that come out of it have to start with science, and then the ideology follows. Yeah. I think what we saw with this administration was that the ideology was getting into the actual practice of the science and trying to say, this is what I want to see happen, rather than saying, this is having presented the findings and then making some ideologic decision with it. So keeping the ideology out of the scientific process has got to be paramount for moving forward so that we can have an objective, evidence-based approach to public health.
Absolutely. Thank you so much. And Dr. Patel, one thing I hear from families in my district is that they want honest information, even when the answers are complicated. They want to understand not just what the recommendation is, but why it's being made. Can you talk about the importance of transparency in vaccine policy decisions, especially in this time of turmoil?
Absolutely. And I want to also comment that I do think pediatricians also missed the mark a while ago. I want to admit that. Vaccines are exceedingly safe. They also have exceedingly rare side effects, exceedingly rare. And our messaging to the public was, vaccines are safe, of course they are, and there are no side effects. Once you lose trust, you lose trust. So I think the only way to bring everyone back to the table is honesty and science, because science is not an opinion, it's a fact. So saying it's a fact that children's lives are saved annually, every single year, is a fact by vaccines. Also saying that a handful of children get Guillain-Barré is also a fact. And I think it's how we share these facts, and I do that a lot online, much to my own chagrin, but unfortunately that's where people are getting their information. And if you start from a place of honesty, you gain trust. And when you gain trust, patients listen.
Thank you so much, Dr. Patel. I know that resonates with my own family's experience. My mom was a little vaccine hesitant when my brother and I were born, but then I had a sister who was born with incredible medical complications and disabilities, and we became a family that advocated for vaccinations so that Olivia could be safe and healthy. And I think information for families is so, so important. Thank you. Yield back.
Thank you. Thank you very much. Next up, we have Representative Simon.
Thank you so much. I am so honored that I get to be in space with you all talking about these issues. And I have remarks prepared, but in the last 15 minutes, my heart sank. And I remember, and you, physician scientist, you've been with many families like the one that I'm about to talk about, and that family was mine. 11 years ago, I lost my husband to a very rare cancer called T-cell prolymphocytic leukemia. And as you can imagine, cancer tore our family asunder. But in that process of traveling states upon states to be involved in a clinical trial that gave Kevin another year and a half of life, it's the reason why Layla, our daughter, knows his voice, was a clinical trial. And while, again, he is not here, I am so thankful for the scientists and researchers for giving us just a little bit more. And Dr. Anita, this question is for you. The National Cancer Institute announced that last year that it would end funding for the Pediatric Brain Tumor Consortium, which is a network of doctors and scientists at hospitals all throughout the country who have been working together for 25 years. And it's given young children access to opportunities. And you know the families, when you get a terminal illness, you're just waiting for a call. And can you imagine your baby who may not make it much longer gets a call and they bring that child into a clinical trial. And that clinical trial is defunded. Dr. Anita, can you take us through what happens? Because clinical trials for children, terminally ill children, have been defunded underneath this administration. And I think we need to tell the story about what it feels like for a parent to have to bring their child into clinic and get the port taken out and the drugs no longer administered. And that child, because of decisions made on this campus, will not live to be teenagers. Can you tell us a little bit about what's happening around the country to our children because of these decisions?
Children are always the first to suffer from any public health decision. That is a fact. And honestly, the ICU is a microcosm of those facts because we see the children who are suffering from cancer, from brain cancer. I have taken care of too many children in the DIPG to count. That is my universe. When you give hope to a family through a clinical trial, you are not just giving them medicines that will potentially save their lives. You are giving them a lifeline.
Yeah.
And I want to speak for the kids too.
Yeah.
Because these children don't understand what is happening. These children believe that our country is trying to hurt them.
Yeah.
And these are not my words. These are the words of my patients.
That's right.
And when you start attacking children with cancer by threatening to defund the research, you just told a child who's in a phase 1 clinical trial, who suffered through medications, because we need to be honest about this. These children go through so much.
So much. Yeah.
Not just for their own selves, because they are told, and it is truth, that they are going to help other children. So when you suddenly cancel or don't extend a clinical trial, you have needlessly caused that child to suffer. And you have needlessly taken away the hope that that entire family has. And I know my colleague next to me can speak to that as an individual because he was that person.
I appreciate your answer so much. And I actually do have another 45 seconds, please, sir.
Thank you. When my daughter was diagnosed with a terminal cancer, I always held out hope that tomorrow was the day that a new clinical trial would open.
That's right.
And when that didn't happen on that tomorrow, there was always another tomorrow.
Yep.
And it does provide hope. And the cancellation of the PBTC and it being rolled into PEP-CTN doesn't make sense because of these specialized issues that kids with brain cancer face. Not only do you have to get past the blood-brain barrier, but you have to get drugs in with such concentration that the toxicities increase, that it's not something that should be generalized.
That's right.
We need the PBTC. We need specialized and specific consortia to deal with issues of that nature. And it is hope. It absolutely is hope.
I want to really thank our chair for calling this hearing and for you all for testifying. There was a little girl, I know I'm over time, who came into my office just a few weeks ago. Her name was Penny, and she is one of the most beautiful children I've ever seen in my life. She's 9 years old. She had neuroblastoma. She has gone through 2 stem cell transplants, 2. And for folks who are in the sector, you know what the conditioning can do to a body of a little 9-year-old, and yet she has hope. I am hoping that everyone in this room and that folks in every building in this complex could fight harder for the pennies of the world, that they deserve everything, including treatment and the brilliant scientists that are working day in and day out to give them more life. Shame on this administration for cutting opportunities for children to grow old. Thank you, and I yield back.
Thank you, Representative. Next up is Representative Walkinshaw.
Thank you, Ranking Member, and thank you to our witnesses for being here. My district in Virginia is home to nearly 50,000 federal employees, including many of the scientists, epidemiologists, researchers, public health professionals whose work helps keep Americans healthy. And much of this work is invisible. Most Americans do not see the disease detective tracking an outbreak, the CDC scientists monitoring a new threat overseas, or the researchers working on the next treatment for cancer, Alzheimer's, or diabetes, but Americans benefit from that work every day, or they did. That's why I'm so concerned about what we've seen over the course of this administration. Far from making America healthy, they've taken the chainsaw to America's health. A Senate-confirmed CDC director was fired after a few weeks on the job. Senior CDC leaders resigned in protest. Thousands of public health and research positions eliminated or disrupted. Grants for everything from infectious disease to Alzheimer's paused and are now being politicized through new policies that would subject all grants to political review. DOJ publicly admitted that Ebola prevention activities were accidentally canceled. I'm going to come back to that. And USAID's disease surveillance and outbreak response infrastructure has been effectively dissolved. Americans were told and are being told that these actions are taken to make our government more effective and to put America first. In reality, these actions have made Americans sicker, less safe, and more vulnerable to disease. Dr. Jernigan, I want to turn to Ebola. We all remember, perhaps, I certainly remember, Elon Musk in the meeting in the White House with his T-shirt, casually admitting that DOJ, and these are his words, had accidentally canceled Ebola prevention activities. He said, quote, "We will make mistakes, we won't be perfect." Now, a typo is a mistake. Leaving out a feature on the latest Model 3 is a mistake. Canceling Ebola prevention is a hell of a lot more than a mistake. Now, Dr. Jernigan, he went on to claim, though, that Ebola prevention work was quickly restored. So they identified their mistake and quickly restored the work, and it went on as it had previously existed. I just want to ask you, in your opinion, based on your knowledge, was the Ebola prevention work canceled by DOJ completely restored and renewed after it was accidentally canceled?
Yeah, so I think there are a number of staffing changes that have had significant impact. I think right now the Ebola response is not able to do what it should be doing because USAID is not in place. Those folks are not there. And the number of people that the CDC needs in order to respond quickly are not there. So those things, the immediate cuts, if they were put back, I think what we're seeing now is the continued secondary impacts of all of these other cuts that have happened. They were haphazard, they weren't directed, and they were not strategic.
I want to ask you about USAID and Ebola because most Americans hear USAID and they think foreign aid. But from a public health perspective, USAID helped, I say that in the past tense, helped support the surveillance networks, the labs, the logistics, the local partnerships that allowed the United States and the CDC to detect dangerous outbreaks before they spread. Is that an accurate description of USAID's role previously?
Correct, yes.
Okay. And just for the record, Congress never voted, I certainly didn't, to eliminate USAID and these programs. Yet the administration froze assistance, terminated the programs, eliminated staff, and effectively dismantled the agency's capacity, including their role partnering with CDC to detect and help prevent outbreaks of infectious disease like Ebola. Is that correct?
Correct.
Okay. Can you tell us the specific capabilities that CDC relied on from USAID that no longer exist?
Yeah, so in 2014-15, I served in Sierra Leone and then in Guinea for a very brief period of time, and then served as the incident manager at CDC for the Ebola response. When we were in the field, it was like us together. We actually sat at the same table and worked in Sierra Leone. They were the logistics. They were the ones that moved things. We were the technical experts and could say, let's do some head work. This is where you need to send things. You can't just have technical experts and not have the logistics and the operational capabilities. And so without them there, CDC may still have some of the same number of people, but they're clearly not able to do the work they were previously.
Thank you. Mr. Faber, your written testimony, you said we should all welcome bold ideas like those proposed in the MAHA assessment and MAGA strategy to make our food safer and healthier and to support the people who feed us. It sounds to me like you had some optimism about this MAHA agenda from the Trump administration. Is that accurate? When it started, you were optimistic.
That's right.
Okay. You go on to say, but so far the administration is trying to have it both ways by sounding the alarm about food safety failures and diet-related diseases by making bold promises to help Americans, but so far failing to deliver on those promises and instead adopting policies that make our food less safe, less healthy, and more costly. Are you still optimistic about this administration's commitment to their agenda, to make their stated agenda to make America healthy?
These ideas are not only nonpartisan, they're not even political. Everyone wants safe, affordable, healthy food. So far, this administration has made our food less safe, less healthy, and made the real foods that they've encouraged us to eat more costly.
Thank you. I yield back.
Thank you, Representative. And now I'd like to welcome and thank Representative Ruiz and Dr. Ruiz, who also led our select subcommittee on the pandemic, which it was a pleasure to be a part of, with you led us through, and turn it over for questioning.
Thank you. I truly want to thank you, Ranking Member Garcia, and also Ranking Member Blumenthal for this incredible hearing. Very important that we state the facts and really push back as much as possible in order to keep American families safe. The Trump administration made many promises, chief among them to tackle the rising costs of living and to quote-unquote make America healthy again. Well, surprise, surprise, they lied. They lied when they cut and disrupted billions of dollars of scientific research funding, delaying or halting discoveries of potentially life-saving medical treatment. They lied when they withdrew from the World Health Organization and cut hundreds of millions of dollars that are now prohibiting multiple countries from coordinating to their fullest capacity to protect us from any kind of emerging diseases that may come to our shores. They lied when they blatantly dismantled the childhood vaccine schedule, jeopardizing the health and well-being of children and families across the country. They lied when they made deep cuts to food assistance programs, causing children to go hungry. And they lied when they cut nearly $1 trillion from Medicaid, threatening health coverage for 15 million people, including children. That is why we have to call them out on their BS and bring to light just how harmful these misguided policies truly are. When people are losing health insurance, when parents are too scared from vaccine disinformation, when hospitals shut down because increasing uncompensated care pushes them to the financial ruin, that's directly hurting Americans. And that is making America unhealthy. That is putting America's health even further in jeopardy and at risk. And as an emergency medicine physician, I have seen the devastating health outcomes that can happen when patients delay seeking care and are not able to access preventative care and primary care. You know this too, Dr. Patel. So Dr. Patel, as a pediatrician, a PICU specialist, you work with patients at a very vulnerable time in their lives. You work with the most vulnerable of our population. And have you noticed a change in vaccination rates among your patients? And how have those conversations with parents changed since the Trump administration? And what has been your lived experience with flus and measles?
Thank you for that question. I have fortunately not had to care for a measles patient since my residency and fellowship in New York due to the population, and I live in Washington, D.C. However, we had the worst flu season 2 years ago. Our ICU was full. And when I say full, I mean children on ventilators. We had to call neighboring hospitals to send us high-flow nasal cannulas, CPAP, BiPAP, and ventilators. We had to get extra ECMO circuits because we were so overwhelmed. In our ICU today, we have a purple dot. That purple dot we put on our board that indicates that a child is unvaccinated. I never thought in my lifetime career in Washington, D.C., I would need a purple dot to indicate when a patient is unvaccinated, not to cause any ill will towards the family, but because, as you know, we need to treat those kids differently.
Yeah.
So I would say that if I am seeing unvaccinated children in the nation's capital, I can say with certainty that the crises we are seeing will compound.
And as you mentioned in your testimony with a child born with congenital heart disease, you're speaking to some of the more extreme example of vulnerabilities. But we also know that that children are just vulnerable because of their immature immune systems. And having rampant flus going around their community and their household can be very damaging as well, correct?
Absolutely.
What's the number one way to help prevent from getting the flu?
The flu vaccine, on time.
And so you mentioned in your testimony in 2025, we've had the worst measles outbreak in over a decade, more than 2,200 confirmed cases, 48 outbreaks, and 3 deaths. 93% of cases were in individuals who were unvaccinated.
Yeah.
So 2,200 cases in 2025. 2026, we're halfway done, and we've already reached 2,160. So we're on par to being the worst measles outbreak in the U.S. probably in decade, more than 30 years for sure. So this is why the American people need to understand that all the doubts that the vaccine skeptics that have really promoted this disinformation with autism and other illnesses that they claim caused from vaccine, that has been proven unfounded scientifically, is harming the children's health. This is why we have to call them out on it. As you said, Dr. Patel, as a physician, there are some risks That's why we have one of the most detailed screening systems in our research processes to identify them. There are contraindications. Some children should not receive certain vaccines. We know that, but aside from those specific individuals, the benefits to population health is enormous, and they are safe, as you've mentioned, for people to take. And so if there's any message, is that this skepticism, this anti-vaccine movement from RFK Jr. and his MAHA politicized movement has been damaging to our children's health and our community's health, and we need to call them out on it.
Absolutely.
Thank you.
Thank you. I want to thank, of course, Representative Ruiz and, more importantly, Dr. Ruiz for your testimony, your work, and, of course, for these great questions. I also would like to turn this over to also another of our doctors in the House, Representative Schreier, who's also joining us, and thank you for joining us today as well.
Thank you, Ranking Member Garcia, and thank you to Senator Blumenthal as well for holding this really important discussion. As a member of the House Energy and Commerce Committee, together with Dr. Ruiz, I cannot believe we have not had a similar hearing, because this administration's jeopardizing and undermining of public health should be a bipartisan concern, and it impacts all of our constituents. Since his confirmation as Secretary of HHS, RFK Jr. has unilaterally changed the childhood immunization schedule. He's fired his own CDC director for not rubber stamping bad anti-vaccine recommendations. He's asserted that Tylenol causes autism. He's fired leaders of an influential preventative services panel, fired all 17 members of the CDC's Vaccine Advisory Committee, fired thousands of HHS employees, and slashed billions of dollars from NIH research. That's quite a track record, and it is not making America healthier. He is unqualified, he's reckless, he is dangerous, he should resign or be fired. Dr. Jernigan, thank you for the courageous steps that you and your colleagues took after Dr. Menard's firing. I was wondering if you could speak briefly to the impact that Secretary Kennedy's actions will have on our public health agencies and therefore on America's health.
Yeah, I think the impacts, some of them we're feeling now, some of them we'll feel later, some of them are very measurable. We've had staff losses. We've had 80% of the center directors, those positions are not filled right now. We have delayed grants. We have interrupted publications, important information not getting out, disrupted programs, and stalled vaccine recommendations. So
now,
all of those things together.
When things change, say in a couple years, we have a new president, new administration, do you think people will come back? Will they trust the federal government?
I'm not sure, because there's been some real hits to the scientific credibility by what's happened with the ACIP, what's happened with the Preventive Services Task Force, and people are looking to other places to get recommendations. And so to make that change, we're going to have to do some real work.
We sure will, and we will work with you on that. I wanted to turn to research. NIH is arguably the crown jewel of American excellence in cutting-edge medical research, really the envy of the world. Just brought to you by NIH, the human genome mapping, CRISPR technology that can now cure sickle cell disease, nearly all immunizations, starting with polio, most recently mRNA vaccines, cancer immunotherapy, HIV retroviral drugs that turned HIV from a death sentence into a manageable disease, GLP-1 drugs saving lives now, the MRI machine, the insulin pump, and the artificial pancreas. I'm a pediatrician. I see NIH research at work all the time in my patients' lives, and right now the Trump administration is injecting partisan politics into deciding which research projects and which institutions will get NIH funding. In fact, the OMB just last month issued proposed rulemaking that would grant political leadership final authority over NIH awards. Mr. Agin, what has already happened to medical research in this country, and what do you anticipate will now happen with this new rule from OMB?
I'll start with answering the question about the new rule. It's ludicrous.
Yeah.
I've sat on numerous research review panels, and they should be staffed and led, and decisions should be made by scientists. The result of these policies is that young researchers aren't seeing the viability of going into a career in research. They're not seeing the same support levels. Established researchers are worried that they're going to have to scuttle their laboratories because of these changes. It's creating a complete climate of fear and concern for the viability of a path in science.
I'm very worried about that too. And just to put an even finer point on it, it is already so hard to get an NIH grant for your research in this country. Scientists review these. There is so much scrutiny to make sure it is a good study, a worthwhile study, worth public dollars being invested, that this is just another hoop that is arbitrary and capricious and will likely be used against certain universities. I also just wanted to mention, research is still there. It's just that China is quintupling down on their dollars that will go toward research while we are kneecapping our own research institutions. It's absurd. It's undermining our national security, frankly. I'm out of time, so I'm going to yield back at this moment. Thank you.
Thank you so much, Representative. And with that, I just want to, as we close this hearing, I do want to thank all of our witnesses for being here, and all the representatives that were here on behalf of the Oversight Committee and beyond, as well as Senator Blumenthal. Senator Blumenthal and I have been hosting these hearings on a variety of topics as it relates to oversight. And again, I just want to close by just saying again, what is happening with President Trump and with Secretary Kennedy are not making America healthier. In fact, as you have all testified, we're becoming less healthy. Vaccinations are in peril. More families will get sick. More children will be put in danger. Polluters are gaining more influence in putting into our foods things that make us less healthy. And as we know, whether it's clean air, clean water, or what Americans buy at the grocery store, none of it is making us healthier. And so with that, we're going to conclude this hearing. I want to thank all of you for being here today. Thank you.